Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 14 homeopathic remedies for children earache. What is the anatomy of ear? The anatomy of the ear has been shown, details in this picture, and here is the description. Ear has got three parts: external ear, pinna, and ear canal. Pinna, this is pinna, and this is ear canal, not the drum. The drum is a part of the second part. Middle ear, eardrum, ossicles, malleus, incus stapes, and auditory canal, the canal joining the middle ear with the throat. In some books, it has not been included in this middle ear. In some book, it has been. So I have written here and with this interrogation sign. Number 3, internal part or internal ear, semicircular canal. Semicircular canal, internal ear, a part of the semicircular canal, and cochlea. This is the cochlea. This cochlea and semicircular canal. This is the anatomy of ear. You must know this because while describing medicine and various other things, this name will be referred to very often. And if you do not know where is it, then the reading will be disturbed. What is the physiology of ear? That is functions. Functions of ear. External ear collect sound and send it to the eardrum via ear canal. Okay, nice. This is external ear, collect sounds and send it to the drum. Middle ear amplifies sound to reach same to the internal ear. This middle ear, this is eardrum. Eardrum receives the vibration, and that vibration is increased with the help of the small bones and send it to the internal ear. Internal ear keeps body balance. Internal ear has got two parts, one is this, another this. These two semicircular canal and cochlea. The cochlea is filled up with perilymph, and this perilymph conduct the electrochemical impulses to the nerve, auditory nerve, for hearing. That is, vibration is taken up by this fluid, perilymph fluid, and there are so many fine hair-like structure here. They just carry these fine sounds and convert it to electrochemicals impulses and send it to the auditory nerve. This perilymph is fluid here. Here, semicircular canal is filled up with endolymph, another type of fluid. They keep the body balance. That is, whenever we feel loss of balance, the endolymph gives sensation that you are falling. Please support, give support. And this three small bone, they increase the vibration of this eardrum. What is earache? Earache or otalgia or otitis, something, is one of the symptoms of inflammation of ear, generally of middle ear. Actually, earache means almost 90%, in 90% cases it is middle ear inflammation. Most commonly seen in children of all ages. Children of all ages. However, strictly speaking, otitis is of three types. Otitis externa, that is external ear inflammation. Otitis media, including mastoiditis. Otitis interna, internal ear. Now, what are the causes of earache? Causes of earache may be diverse. Namely, example, the boil or foreign bodies in external ear. In its external meatus. Meatus means that channel. Otitis externa, otitis media, mastoiditis. We will be coming later on. What is mastoiditis? Tympanosclerosis from cold, infection, adenoids, glands. Tonsil-like glands, adenoids, catarrh, sinusitis. Sinusitis also gives rise to earache. Sinusitis, chronic tonsillitis. This is also a source of earache. Whooping cough can also affect your ear problem. From whooping cough, ear problem. Excess deposit of cerumen. Influenza, diphtheria, from many other causes of constitutional nature, that is scrofullosis pseudosora. This is exclusively the part of homeopathy. scrofulosis, pseudosora, this term you will never get in any book of modern medicine. This is a part of homeopathic medicine, exclusive. I will discuss it in proper time. What is otitis externa? It is the inflammation of the ear canal due to collection of water-like substance therein. This is ear canal. From this to this ear canal, this is pinna. Owing to infection or foreign bodies, ear canal adjoining tissues get red, hot, painful. Ear canal itches, transparent, odorless secretion occurs. There may be fever, swelling of lymph glands around, that is around the ear. There are so many lymph glands. They may be swollen up. As disease progresses, troubles of hearing start generally. Then thereafter, treatment objective is to stop the inflammation. This is very simple thing. External inflammation is stopped. There are so many medicine in all practice of medicine of different pathies. What is otitis media or middle ear infection? This is most important. From inflammation of resulting infection in middle ear, fluid gathers arresting vibration of eardrum and ossicles. Sound vibration cannot reach internal ear. Problems in listening starts with other symptoms. You look at this picture. This is healthy in middle ear. This is the canal. This is the drum, malleus, incus, stapes. Now look here. The whole thing is filled up with yellowish color. Yellow color means this is inflammatory fluids like pus or say various types of other types of secretions. Whole secretion is filled up in the middle ear. That is, it is inflamed. When it is inflamed, the eardrum will bulge out. There will be pain. There will be trouble in listening because these ossicles will be disturbed while transmitting the sound. That has been all recent. Symptoms: earache, fever, pus secretion from the ear canal. Ear canal means this canal, because very often when it is inflamed, it is perforated and pus comes out through this channel, external ear. From here, disturbance in balance of the body, because it is disturbing also internal ear, because middle ear infection means infection is reaching in the internal ear too. Hard of hearing, there is the hearing capacity will be less and less. Treatment: remedies to stop infection. Cure is available in homeopathy and tissue salt therapy. Also surgery by draining gathered fluid in modern medicines. What is mastoiditis? It is severe type of bacterial infection where air cells in the mastoid bone gets damaged. Now, mastoid process, I have not described it before. Note here, just behind ears, if you can put your finger, you will see that there is a hard triangular bone. This is called mastoid process. And there are within the process there are air cells. I will show you the picture here. You see this. This is the air cells. This is mastoid process. This is the air cells. There are so many in the bony part. There are so many void spaces. This is called mastoid air cells. Symptoms: backside of the ear get reddened. This portion will be reddened. This is the picture of mastoiditis. Not direct ear infection, just mastoiditis. Backside of ear get reddened, swollen, sore, hard of hearing. Treatment available in modern homeopathy, TST. Complication: if infection is not properly treated, it may spread to brain, because this portion, I mean this air cells, is somewhat related to internal brain also. So that will endanger the life of the patient. Mastoiditis is more serious than otitis media. What is tympanocalorosclerosis? Now see, tympanocalorosis is a big term. You might have raised your brow. What is this tympanocalorosclerosis? Actually, tympanic membrane is the another name of this ear, what is called ear drum. No, not ear drum. That is the block, the by which it is a particular structure which separate the middle ear and the external ear. That is tympanic membrane. A condition caused by hyalinization and subsequent calcification of subepithelial connective tissue of tympanic membranes. Huge technical terms: hyalinization, calcification. The simple thing is that this tympanic membrane, when the tympanic membrane is in the stage of high inflammation, it is called tympanosclerosis, middle ear, resulting detrimental effect to the hearing. Cause not known definitely. Problem may caused by repeated otitis media, insertion of tympanostomy tube, atherosclerosis. Atherosclerosis is a disease of the artery, blood vessels. Symptoms: hearing loss, chalky white appearance of the ear, eardrum, there is tympanic membrane, and earache. Treatment: surgery, modern allopathic treatment. Remedial treatment is available in many other pathies like homeopathy, tissue therapy, etc. What is earache or cerumen? This is very important thing. Day-to-day affairs, in every home it is required. There are many minute glands in ear canal. Secretion of these glands accumulate to create earwax, which often clear out itself. What problems can be created by earwax? May cause infection, may cause hard of hearing, may cause tenderness, pain, may create abnormal sounds in ear, vertigo, itching and cough. How to clear earwax? If there is no pain or infection, get a subject lied down on a side. That is how to clear. How will you clear the earwax from a particular person? Pour normal saline, 0.9% NaCl solution, 7-8 drops in 1 ear. Wait for 10 to 15 minutes. After 10 to 15 minutes, turn him up, and on other side do the same. The process may be repeated if necessary. In place of normal saline, hydrogen peroxide, carbamide peroxide, olive oil can be used. Now in the starting, I have written if there is no pain or infection. So what happens if there is pain or infection? Then you should not try anything. You must contact a ENT specialist. Now, remedies. Nitric acid for children earache. Hardness of hearing from induration and swelling of tonsils. After abuse of mercury. Terribly offensive purulent otorrhea. Carries of mastoid process. With the middle earache, there is damage of this mastoid process also. Roaring, beating, detonations in ear. One's speech echoes in ears. This is autophony. Subjects irritable, vindictive, hateful, trembles when angry. The last line is the general symptom of nitric acid, and the first few lines are the particular symptom of the disease. Phosphoric acid for children earache. Hard of hearing from mental or bodily exertions or after severe acute disease. Infection of ear. Patients do not hear the ticking of watch when held at a moderate distance from ear. When held close to the ear, hear only a hissing sound, no ticking. Hear it more distinctly at a foot and a half. This is testing of the ear, how sensitive it is. And if this is okay, then this is the medicine. Subjects indifferent to everything. Poor memory, homesick, lachrymose, hopeless. General symptom of phosphoric acid. Last line. Netamir for children. Earache. Hardness of hearing. When masticating, painful aching, cracking in ears. Various crackling sound in the ears. Secretion of ears more watery than visits. Watery much. Worse in damp weather. Subject might be sensitive to table salts. Hateful to them who offended them. Avoid fuss. Subjects avoid fuss and company. Reserved. Get angry when consoled. Meserium for children earache. Vascular deepness with chronic eczema of tympanic membrane. Ears feel as if too open, as if air were pouring in them, as if tympanic membrane were exposed to cold air with a desire to bore with fingers in the ears. Many body do this. Subjects indifferent to everybody, everything, averse to talk, and very much quarrelsome. Fame for children earache, a tested remedy for first stage of acute otitis, especially for weak anemic children when tympanic membrane is red, bulging with mucopurulent discharge. That is the first stage of inflammation of the eardrum. Causative factors: exposure to wet weather, drenching in rain. When belladonna fails, ferrum comes and takes up the situation. Chamomilla for children earache. They grow frantic in pain. They means the patient. Pain comes in paroxysm. Swelling, ringing in the ears, worse from warmth. Face red, very cross. Want various things but petulantly throw them when offered. Always whining, like to be carried. More general symptoms are there, but most important for selection. Aconitum napellus, actually full name Aconitum napellus. In short, many call it as aconite, simple aconite, okay, aconite nap, okay, aconite napellus, okay. For children earache, caution: attack sudden after exposure to cold wind, change of weather, external ear hot, red, swollen, sore, pain, stinging, lancinating, throbbing with great soreness, and aggravation at night. From warmth, faces anxious, fearful. Dr. Baez opined 1x aconite is infallible in maddening pain of otitis. 1x means almost mother tincture. Belladonna for children earache. Sudden violent attack from exposure to cold wind after haircut, uncovering head, wetting head from sun, summer, tympanic membrane congested, bulges out. Subjects furious, delirious with red face, eyes, throbbing of carotids, cannot bear touch, jar, motion, cold air, better from warmth. Note here, this is better from warmth. This is a very important point, but previously in aconite it was not so. Please compare belladonna aconite, because both are the remedies for acute stage, and there are many common symptoms in aconite and belladonna also. So this particular symptom, whether the person likes warmth, whether it is gives him relief, or it worsens the situation, depending on that you can also select whether it is aconite or belladonna. Please read carefully. Epar salve for children earache. Ear very sensitive to touch. Sensation as boils are there. Swelling between ear and mastoid process with throbbing pain. Profuse discharge of thick earwax. Not exactly pulse, but earwax. Subjects oversensitive to all external stimuli. Ferocious, wants to kill who offend them. Impulsive, hasty in every action. Nothing please them. Very cross. General symptoms. Caliphos for children earache. Deafness of old people. Deafness owing to nerve atrophy. Mind this is nerve atrophy, but externally you cannot know whether it is nerve atrophy or it is inflammation. So you have to go by the symptoms. Highly prostrated and nervous. Here various subjective sounds like humming, buzzing. Tinnitus from anemia. Tinnitus also same thing. Various different light sounds, tingling sounds are heard by the person himself, but nobody feels it. The person only feels it. This is a symptom of anemia also. Subjects suffer from religious and financial melancholy. This is Caliphos general symptoms. Indisposed to do anything, forgetful, night terrors. Causticum for children earache. Deafness from rheumatic paralysis of face. On turning head, cracking, snapping in ears. Reverberations of all sounds, even of his own voice. This is listening his own voice. Listening his own voice, it is called autophony. Offensive purulent discharge from ears, worse in clear fine weather. Clear fine weather, worse situation. Better in damp weather. You can take it as an USP also. This is also uncommon, strange, peculiar symptom. Better in damp weather, worse in clear fine weather. Subjects oversympathetic, loss of memory, unmindful. This causticum patient is very much sensitive to other suffering. They feel bad for others suffering more than their own suffering. Graphite is for children. Earache. Deafness with dye external meters. Hear better in noise when riding ears. Another USP. Hear better in noise and when riding ears better. Tympani intact. That is tympanic membrane is intact but covered with white coating. That is inflammation is there. Sensation in right ear as if at every step a valve were opening and closing. This sensation, particular sensation of the person. This is another peculiar sensation, so it is USP, uncommon, strange, peculiar. Reverberation of own words in autophony, harpies and crust around ears. Subjects timid, indecisive, fidgety, forgetful, make mistakes while writing, talking, weeps without cause, and from music. This is general symptom of graphitis. Last 2 lines. If general symptom can be matched with this particular symptom, then that medicine is a must. But if you get one USP, one single USP can give you medicine, the direction to the medicine. USP is such a weight and such a powerful symptom. Carboanimelis for children. Earache. Thin, ichorous, bloody, excoriating otorrhea, swelling of periosteum over mastoid process. Auramnitic acid also has got this symptom. Hearing weak, confused. Tone appear mixed. Cannot say from which side they come. They come when sound comes. Patient cannot understand from which side sound is coming. It seems as if they come from another world. Subject desire to be alone, sad, avoid conversation, homesick, fear of darkness, worse on closing eyes. General symptoms. Symptom of the particular person. Carboanimelis person's symptom is this, and this portion is a general portion. This is the particular portion, disease. Petroleum for children. Disagreeable sensation of dryness in ears. Eustachian tube affected, causing wheezing, roaring, cracking sound. Eustachian tube. This is the tube, Eustachian tube. This is throat and this is middle ear. The interconnecting tube is called Eustachian tube or auditory canal. Polyps in ears, deafness from paralysis of auditory nerves. Subjects worry but know not why. Lose weight in street. Loss of memory. These general symptoms. Petroleum person, general symptom.